Right, welcome back to episode 6 of MEALZEE Minutes, and today we are talking with Melanie Walters. Hang on. I'll start that again. All right, welcome back to episode 6 of MEALZEE Minutes, and this is where we talk about all things health and fitness. And today we have welcome back the amazing Melanie Walters, who's a low-carb dietitian at Sante Medical up in Brisbane at Paddington. And last week we talked about diabetes, Mel, with low carb, but today we're going to talk about PCOS because this is a fairly prominent problem that we see in clinic as dietitians, and I imagine this is a fair load of your caseload.
It really is, and I'm seeing a lot of my younger patients with PCOS. So I see a lot of women in the early to late 20s, sometimes women who are, thinking about getting pregnant maybe sometime in the next few years and really want to get a handle on what they can do to treat their PCOS.
So can we take a step back for anyone not aware? What is PCOS? Like, what's it stand for, and what are its origins? And if you knew nothing about it, how would you explain it to someone?
Yeah, well, its full name is polycystic ovarian syndrome, and so it's a hormonal condition that it causes some problems with the ovaries, which I'm no expert on, but it has whole body kind of effects, and it leads to increased insulin resistance, problems with ovulation, and then that can lead into problems conceiving. And often the girls are finding themselves putting on weight. There can be some excessive hairiness, so like male pattern hair growth. So that's what often alerts women to the fact that they have these problems. Like they sort of are feeling that they're, getting some upper lip hair, they're gaining weight, their periods are irregular. And then when it's usually diagnosed, I think, by an ultrasound of the ovaries showing multiple cysts on the ovaries. So
yeah, right. And so the implications of that is, there's fertility issues, and is there much pain with it? Like discomfort?
I don't think there's necessarily a lot of pain or discomfort, but there's generally, it's that weight gain that is the problem. Increased insulin resistance. So having polycystic ovarian syndrome increases your insulin resistance, which then increases your chance of weight gain, which then increases your insulin resistance. So it becomes very circular. And so, a lot of women are told by their doctor, losing some weight will help, but they're not given any real advice about how to lose that weight. And that's how they end up finding themselves with me.
I like the way you worded that, in that it's insulin resistance then weight gain, because like a lot of I've had clients come to me in the past, and I'm the same. I'm no expert with PCOS, but I've had clients come to me in the past where like they're kind of told you've got PCOS because you're overweight, but it's not necessarily that, is it? I mean, I've had clients who sort of lower end of BMI range that have PCOS, but it's the weight that can, I guess, exacerbate the problem. Is that a fair way to describe it?
It definitely does. The weight does exacerbate the problem, and losing weight in conjunction with lowering your insulin levels can really help to regulate those hormones.
Yeah.
And,
okay, so
that's the long-term goal, is to regulate the hormones, get some regular ovulation happening, and then that's going to increase your chances of having a successful pregnancy as well.
And so as a low-carb dietitian, like, run me through that. Like, I've come to you. I obviously haven't come to you, but ladies come to you with, PCOS. Where do you start? Like, how do you help them?
Well, again, it's looking at what they're doing on a day-to-day basis and what their regular diet looks like, and looking at how we can decrease that carbohydrate load. And as I said, it is these young girls who might have just finished university. They might be working for the first time, so they might have had some big dietary changes in their life that is sort of exacerbating the problem. So they might have moved out of home, or they might be working, so they might be buying sushi rolls and chicken katsu curries every day for lunch, or so there's things like that might have changed over the last few years as well, that have then impacted that weight gain and then impacted that hormonal problem. So just looking at how we can dial back those carbohydrates.
Yeah, so you're just trying to help manage that insulin resistance from a diet perspective. Just I guess to give anyone listening, and I know this is going to be really broad because it depends on the person, but if you were trying to put together the perfect low carb healthy diet for someone in that age bracket, can you just give an example of what that might look like from breakfast through till dinner?
Definitely. So this has been my ideal kind of recommendations, but this, as I've said before, I would definitely personalize this to the person and look at where they're starting from. But I'd like to see a patient eating something like an egg-based breakfast, like an omelette with some added veggies. And I often tell people, because people groan at the thought of making eggs first thing in the morning, but a frittata can be a good, make it up for a few days. So with lots of low carb veggies in there, your spinaches, your mushrooms, things like that. And then for lunch, leftovers is often a good way to go. I really like to see my clients taking their lunch to work. That's what I really do advise. So a nice big salad with a hefty chunk of protein. And I always say to people, I don't want a little sprinkle of ham. I want, the sort of portion you'd have for your dinner, like a palm-sized portion of some chicken or, a decent tin of salmon or tuna, something like that for lunch with lots of leafy greens and other veggies in there. And then dinner, a nice piece of protein with a decent portion of low carb veg. So looking at things like lots of broccoli, cauliflower, things like that, beans, zucchinis, things like that. So mixing it up, food variety is very important as well. But that's obviously kind of an ideal day.
Yeah, and so they're still getting plenty of fiber through all of those veggies. That's
Exactly.
a really healthy way of eating. What if they're a snacker? What might you suggest as a snack in between?
I really do suggest my insulin-resistant people try not to snack if they can. Because, so every eating opportunity does create a blood glucose spike, even if it is low carb. But I also say you're not going to land there tomorrow. If you're a snacker, you're not going to be a 2 to 3 meals a day person tomorrow. So some good snacks, I would say, are something like some nuts, or looking at some of the high protein yogurts that are around can be a nice bit of a sweet snack if they're traditionally a sweet snacker. And then even if they have got those really kind of sweet toothy kind of things, looking at some of the low carb protein bars or chocolate bars that are on the market these days as well.
Yeah, it's interesting you talk about the snacking and the insulin spikes. It's right, isn't it? It's like the longer you go in between meals, the lower you're going to get that insulin. Yeah.
Exactly. And, that's why we utilize some fasting too down the line. Again, it's not something I'd ask anyone to do straight off the bat, but looking at, some intermittent fasting can be really helpful as well.
We're trying to keep it under 10 minutes, but I'm a massive fan of time restricted eating. Because it is the one, like, in line with our circadian rhythm, but it links nicely with PCOS. But we might even leave that for another episode because it's a fair bit to talk about.
Happy to talk about that.
Yeah. So, Mel, okay, so we've got their diet down. What else can they do? And I mean, yes, you're the dietitian, but like, what other lifestyle things do people need to be aware of when they're trying to control those PCOS? Because you're working, you're integrating with the doctors there that are helping them at the same time. But what else can they do from a lifestyle perspective?
Well, I like to see people moving, of course, so getting at least some incidental exercise, looking at your 10,000 steps as a baseline goal. I think I find that it's very hard for people to shift weight by any means if they're not getting a decent amount of physical activity. If you're sitting around and getting, 2,000 steps a day, no matter what you do, I think you're going to find weight loss quite difficult. And so then ideally, I'd like to see people adding in some weight training at some point, some strength training just for really helping get that insulin down further. And maintaining muscle mass during periods of weight loss is important.
Yeah, the resistance training is not just for young men trying to get their beach body going. It's for everyone, isn't it?
It really is, and it's so under promoted, I guess. And it doesn't have to be a big gym workout, but just some, even like I said, people, even some body weight squats. Just finding some time in your day, do it while you're boiling the kettle, or just getting into large muscle work at some point.
Yeah.
And avoiding chronic cardio is another because people come in and they say, oh, I don't know why I'm not losing weight. I'm working out, 6 times a week. And sometimes that's just an added stress on the body. And
yeah,
if your body's under stress, it's not going to release weight either.
yeah.
So stress management is the other big thing I recommend to these patients as well, like, meditation, yoga, things like that, to really get their stress under control if that's a factor in their life.
Yeah, all things that were probably considered fringe alternative options, 10, 20 years ago are really clinical interventions these days, aren't they? And that's things like meditation. Now, Mel, I think we've just about gone over our 10 minutes, so I need to try and keep to my word to people and keep these under 10 minutes. So thank you so much for your awesome advice. Anyone listening to that, has PCOS or is in that area, I think will really gain from that diet insight. So thanks again.
No problem, Chris. Thanks for having me.
Always welcome.